Many children and teens have fears from anything from being safe, doing something wrong, or something really bad happening. Many young kids like to line up their toys and like to count things. So these can be a normal part of development. But what parents really want to know is when does this cross the line? When does it come from that's part of their normal development to when does it become a problem, or in our language, a disorder?
Sure.
So we're here to talk about obsessive compulsive disorder and along with that anxiety, but mainly OCD. And I'm joined by Andrew Cohen. Andrew, thanks so much for doing this with me.
Absolutely.
I'm excited about our conversation.
Me too.
And to get you to know Andrew, first of all, I'm Dr. Chris Tolcher with Parkway Pediatric Medical Group. We're in Calabasas. Andrew is a licensed marriage and family therapist. He's the founder of Cohen OCD Therapy in Westlake Village. Received his bachelor's at UCLA, so we're fellow Bruins.
Let's go.
Hold us back from doing an 8 clap right now. So he has a lot of experience in this space. He's an active member of OCD SoCal, which is an affiliate of the International OCD Foundation, and really just has extensive training experience. But I also learned, Andrew, when I was on your website, you have a brief little YouTube video where you talk about a little vignette of your own experience with OCD.
Totally.
Where you said symptoms starting at age 8. Talk a little bit about your journey and how that's impacted you as a clinician.
Yeah, so anxiety is definitely no stranger to me. I think around probably 5, 6 years old, I developed some really significant separation anxiety related issues, huge tantrums that drop off, my brother was at my school in 5th grade when I was in kindergarten, and a lot of times he would have to come and calm me down, and big scenes basically. And I couldn't sleep out from home, and that whole issue lasted for a while up and into my teens. But the OCD itself kind of started showing up, I would say around 7, 8 years old. Now looking back and we'll talk a little bit more about intrusive thoughts. And for me, it kind of manifested as fear of harm coming to myself or people I care about, and really scary, really troubling thoughts, and in my dreams too. So it was challenging.
Your story is a lot like the story of one of my daughters. She's my youngest of 3. Similar to yours, she started to have bad separation anxiety, kind of morphed into general anxiety. And then around the age of 7, 8, or 9, fears of harm. Fears of harm that maybe she would hurt us, that she would get hurt. And then it became a lot of ritual calling and things like that. And she was in therapy and it went on quite a road and is doing well. But back then we didn't recognize it as OCD. We thought it was just general anxiety. And you said in your vignette, it took about 15 years from the time you started showing symptoms.
Yeah, it was 23, I think.
Something roughly. And my daughter is a similar story. So I guess I want to start by let's define what OCD is. And then we'll talk about, more details after that.
Yeah, absolutely. So with OCD, I like to think about it, obsessive compulsive disorder. You have 2 parts to it. You have the obsessions and the compulsions. And, you can think about the obsessions as any sort of kind of unwanted intrusive thought, image, urge, sensation, feeling, memory, whatever it is that your brain perceives as threat, right? And what happens is, these thoughts, we call them ego dystonic. And what that means is they are not at all in line with the person's morals and values. They don't want to be having these thoughts. They're extremely disturbing. And OCD, what makes it so insidious is these obsessions know what you care about. So it's going to go after those things, right? So you're bombarded by these really uncomfortable thoughts or images, and it activates that, amygdala, that fight, flight, fear response. So you experience a lot of anxiety, a lot of fear, but also, depending on kind of just what the obsessions are, a lot of guilt, shame, anger, sadness. So needless to say, the way our brains are wired is to get rid of distress. So when we perceive that distress, this is where compulsions come in, right? Compulsions you can think about as any sort of behavior that a person does to try to get rid of that distress, to get rid of the obsessions or the fears or whatever it might be. Compulsions can be both physical actions, so things that you can see somebody doing, moving their body, whatever it might be. In OCD, this can be anything from asking questions over and over again. And anxiety disorders as well, a lot of reassurance seeking. Googling things. ChatGPT now is a very big reassurance seeking place for anxiety and OCD folk. Touching things, making things symmetrical. And then there's also mental rituals. And this is what, I think you talked about the long, time period between symptoms to diagnosis really happens because there's a lot of actions that are going on up here that no one else can see. This could be as simple as counting or praying, repeating, trying to think positive thoughts to drown out negative thoughts, all the way up to what we kind of call rumination, where it's kind of like you're putting on the detective cap, trying to analyze and figure out what's going on. So you have these obsessions, they trigger you. You do these compulsions, and you get a sense of relief. The problem
Briefly.
is very, it could be a matter of a second to a day to an hour. It really just depends. The problem is every single time we do a compulsion in response to those obsessions, two things happen. One, we're training our brain that those obsessions are actual threats, right? And the way our brains are wired is for survival. We didn't always have these cool like technology things and luxuries, right? Mendocino farms delivered to us.
Right.
We lived in caves. So when our brain learns something is dangerous, it's going to scan for it more. So you start experiencing more obsessions, which then, brings on more compulsions. So it feeds itself. The second thing that happens, and this is really the kicker, every time you do a compulsion in response to an obsession, you're robbing yourself of the opportunity to learn that you're safe, right? Same thing with anxiety disorders. They function very similarly. So, OCD, you get these obsessions, these unwanted intrusive thoughts and sensations. You do these compulsions to feel better, and it just kind of spirals out of control from there.
Now, some of the things, if I'm listening to this as a parent, I'm going to know some of the things you just mentioned my child does or has done.
Yeah.
Right? So there's a certain bit of these fears that might be normal. There's a certain a bit of these behaviors.
Yeah.
Lining things up, wanting symmetry, wanting perfection.
Sure.
I think of myself as a bit of a perfectionist growing up, and if something
Sure.
wasn't just right. Now, so I guess my next question is, what should parents be looking for as to when these behaviors cross that line from that's just a little bit of how you are, or it's a developmental growing aspect as opposed to a problem?
Absolutely. I mean, I'm always looking at what's the impairment overall? What's the impairment on the kiddo's life? What's the impairment on the family system's life? Just the family unit as well. A lot of times we'll talk about the accommodation stuff in a little bit, but when a kiddo is potentially prevented from doing their thing that they like to do, what's the reaction? Is it a little bit of a, oh man, or is it like a full-blown tantrum? And this, you're seeing almost just like a caveman version of your kid every single time they're prevented from doing those behaviors. That's more so when we're looking at, well, this isn't really going to help them in the long run continuing to do this. So we got to kind of intervene. So really mainly that functional impairment we're looking at.
So it's holding them back, causing them problems, or they're just stuck on it.
They're
right?
They can't, they're not able to focus in class because maybe they're in their head and they're worrying about something, or they're moving things around, or can't stop thinking about, something bad happening to mom or dad, right? And they're not able to concentrate, or they're not able to go to play dates. They're not able to just go do what's important to them, right? So when it starts literally interfering with the things that they care about and enjoy, that's when we're have more of an issue to be addressed.
So it could show itself. I mean, some of them might have insight and some don't. The
kiddos?
Older they get,
Oh,
the kiddos.
yeah,
well,
yeah.
I guess I'm now talking where maybe when they get beyond the age of 7 or 8,
Sure.
they have a little more reasonability.
Yeah,
And some of them might experience these as bothersome or disturbing, but many of them don't, and that makes it tougher, right?
Totally.
So that's one thing that if you see that distress in them. Like for example, I just had a parent that reached out to me about a week and a half ago that my child is bothered by the fact that he can't stop counting. He's like a fixation on numbers in his head, and it was disturbing to him.
Yeah.
And to me, that's an example of crossing the line, right? And it can get to the point where it becomes a distraction. Some of these kids will show up as possible ADHD, for example,
all the time.
or they could have both, right? There's a lot of overlap between them, right?
Yeah.
So I guess for the obsessions and the compulsions, we're looking for, they just seem to be excessive and sometimes bothersome, but not always. And really just causing problems, like academically, socially. Avoidance is another one, like something they used to like and now they suddenly don't want to go because that's a compulsion
big
as
trigger
well.
for them, and it brings up those obsessions and they want to just avoid it.
Right.
I think, and that's a natural response to when our brain perceives threat, right? And I think that's a hard thing to understand for parents is logically it doesn't make sense a lot of the times, but in the kiddo's brain it's almost like it's on fire, right? That amygdala is firing, that fight or flight's going off, and no amount of logic or reasoning is really gonna break through to your kid at that moment. So it's really hard to see, and it can make parents also just very frustrated, angry, resentful, because they start bending over backwards trying to just make their son or daughter or child
trying to help them.
Exactly.
Right. And we'll get into that, what's the best way to help and best way that you might think is helping, but maybe it's not. So do you see OCD down to about age 7 where it starts to show? I mean, you might
Yeah.
see earlier warning signs, but it's more reliably diagnosed after age 7. Is that
Yeah,
right?
around, I think, don't quote me on this, just remembering back from trainings and stuff, around 7 years old.
Don't worry, you'll be on camera.
Yes, that's good. Yeah, so, I think around 7, years old is when you potentially start seeing it. And then, I think it's about like 50% before adolescence, and then post-adolescence, another 50% around like 19, 20-ish is around another time it can manifest.
Like I think of the parents that ask a lot of their toddler or under age 7. They like symmetry, they like neatness, they like to organize things.
Totally.
Kind of want to help them with that.
Yeah, that is, so like, this is like, I have a 3-year-old or almost 3-year-old, and me and my wife both have OCD, and we're both OCD specialists. So like we see my son doing things, and of course both our minds are like, oh, is that an OCD thing? And then we have to be like, whoa, let's pump the brakes. It's also very developmentally appropriate to have things be a certain way, kind of gain some sort of control over your environment, learning that like, ability to manipulate one's environment and stuff. So yeah, you're gonna see these behaviors, they're in the realm of normal, typical human behaviors. It's just when we get into that excessive nature and the excessive amount of stress that they cause is when we start having concern. It's funny though, because I could work with, a lot of parents who, maybe their kids now like 10 or 11 or 12, and then they can think back to like, even when he was like 3 or 4, he was lining things up, or he, wanted things to be certain ways. I don't necessarily know if that was like, at that point, full-blown OCD, or kind of just
part of their normal development and growing,
and
that
just
then
kind of
morphed into it. Maybe,
took on a life of its own.
Interesting.
Yeah.
How helpful is it? So I think of there's like kind of like a normal, I would say normal anxiety.
Yeah.
A bit of that many of us have.
Yeah.
It can sometimes be a positive thing to get you doing things you're supposed to
it's,
do.
It's a necessary
Exactly.
thing,
It's a very helpful thing unless it crosses that line where it holds you back or cause you problems. How helpful is it in deciding or looking at warning signs or OCD if the obsessions seem just odd or irrational? Like I think of one example is that if I just keep counting to 50, something bad won't happen, right?
Yeah.
So I really want to focus on maybe is it helpful whereas general anxiety might be anxiety about normal life events that are just really exaggerated. Talk about that.
So with generalized anxiety disorder, or GAD, you are experiencing these kind of unwanted these thoughts that are popping in. They are distressing, but they are more in line with kind of like your day-to-day worries, finances, school, friendships, relationships, and things like that. Right. And that can create a lot of fear, a lot of anxiety, and then that behavior, like we talk about in OCD, we call it a compulsion. In anxiety disorders, we call that behavior a safety behavior. So they're kind of trying to do something to relieve that anxiety, to figure out whatever the worry is, and it can feel productive, right? And you can almost kind of like see like, oh, it logically makes sense that, well, you're worried about this test, so you're going to continually worry about it so that you can do well on it. Whereas OCD, sometimes there are those just things, we call them like magical thinking, if you will, or like there's not an actual logical connection between the two. So for example, if I keep it right like this, something bad's going to happen to my son. So if I move it like this, nothing bad's going to happen, right? Like obviously that doesn't make any logical
like magical
sense.
Bargaining in a way, right?
So when we're dealing with anxiety and OCD and anxiety disorders, there's key differences, right? Anxiety is functional. Anxiety is something that is important, like you said, like it gives us the energy to do things, right? If we didn't have anxiety or fear, we wouldn't even be here, right? Or we would have been extinct. Right.
It makes me a good doc. I'm afraid of missing things, making a mistake, hurting kids and their families.
Totally.
Makes me really, it gives me anxiety, but it makes me a good doc.
Exactly. And that's, it can be very functional to a certain extent. The problem is though, when we jump into kind of anxiety disorder territory and obsessive compulsive disorder territory, it's almost this intolerance of uncertainty, right? Yes. The person with OCD and kind of anxiety related issues, want to feel 100% certain that whatever it is they're worrying about will not happen, right? So the kiddo who is, counting to 50 wants to feel 100% certain that if I do this, then, I have a feeling that nothing bad's going to happen, right? The person who has generalized anxiety disorder potentially is excessively worrying to feel 100% certain that their finances are going to be okay, or that they're going to do well in school. Or with social anxiety, they're wanting to be certain that no one's going to negatively judge them, or whatever it might be. So, with typical anxiety, like healthy levels of anxiety, we can kind of understand, like, look, anything's possible, right? But I don't have to bend over backwards and do all these wildly excessive behaviors to kind of obtain that certainty.
That never comes.
That never comes, which is not even possible. And an example is there's this big misconception that people with OCD and anxiety disorders are really bad at handling uncertainty. That's not true. It's just about what their anxiety and OCD latches onto, right? And so you guys drove here today, right?
Yeah.
Where's your car right now?
In the parking lot.
How do you know?
I trust that it's there.
You trust that it's
You're
there.
right. It could be gone.
Yeah.
Good point.
Right.
I'm not looking at it right now. I can't verify with my eyes that it's there.
Totally. So like imagine what would your life look like if you were constantly checking your phone or going to the window or whatever it might be to make sure your car was never stolen. Your life would be...
I'd be stuck.
Right? But
I'd
the
be
person...
impaired maybe from that, right?
Totally. You wouldn't be able to go and help your patients in here.
Right.
You wouldn't have the energy or time to actually use that noggin of yours, that healthy anxiety, to go help others.
Right.
And that's what happens. The kiddo who is really scared of harm coming to himself or his family, instead of going and playing and being the kid he wants to be, is in his head doing potential mental rituals to get that certainty feeling, or asking a whole bunch of reassurance questions. Mommy, daddy, am I safe? Or mommy, daddy, I had this thought. Does that make me a bad person? Right. So they're spending all that energy and time on that rather than just being a kid.
How important is it for parents and clinicians to be able to recognize OCD as itself, as opposed to generalized anxiety?
Yeah.
Meaning, how much does it affect their care?
Yeah, the treatment, totally. So I'm very much of a believer that OCD and generalized anxiety disorder and kind of anxiety disorders in general work very similarly, in the sense that there's something that pops into our brain that we perceive as distressing, right? It activates that fear response, that anxiety, and then we want to do something to kind of get rid of that response. That's something, and in OCD we call those compulsions, and in anxiety disorders we call it safety behaviors. The problem is that that something interferes with our ability to learn that we're safe, right? So those safety behaviors, those compulsions, prevent us from learning that those triggering things, whether it's a thought or a situation or environment you're in or whatever the context is, right, is actually safe. So treatment is kind of working with breaking this cycle. And how we break this cycle, is the only thing we can really control. We can't control the thoughts that pop into our head. The more we try to.
Absolutely.
Right? If I told the person who's watching right now, like, don't think about a pizza, it's going to pop into your
Great.
brain.
I just thought about pizza
I
right
know,
now.
now you're hungry, I'm sure, right? And if I said, hey, don't feel hungry, is that possible just to turn that off? No.
Nope.
But if I told you, stand up right now, could you? Yeah. Right? If I told you to clap, if I told you to do an 8 clap right now, could you? Right? The only thing we can directly control is our behaviors, how we respond to thoughts and feelings. So treatment, in a nutshell, for OCD and anxiety, are learning how to change our responses to those perceived unwanted thoughts, feelings, sensations. Because anxiety isn't just a feeling. Anxiety comes with a whole bunch of thoughts, a whole bunch of beliefs of like, this is not okay to have. This is dangerous, this is threatening, all that kind of stuff. And then on top of that, anxiety comes with physical sensations. Right. The heart racing, the difficulty breathing.
We see it all the time, and kids come in here with physical complaints as their presenting symptom for anxiety.
Exactly.
All the time.
All the time.
Headaches,
right?
stomach aches, trouble breathing, dizzy, lightheaded.
And it's
There's
wild
like 15
because...
or 20 of them.
Sorry. Right. No, it's all good. It's wild because our brain's so smart, because the second we start responding to those other experiences of anxiety as like, our brain starts learning that those exact things are bad and dangerous. So those exact things, the heart racing, the difficulty breathing, triggers more anxiety.
There you go.
Right? And you just get stuck in that cycle. So treatment, we do something called exposure and response prevention, where, there's a number of different treatments, but we basically want to approach the thing that is triggering the person in a gradual manner and helping them respond differently to it. Helping them, instead of running away or trying to drown it out, kind of be like, oh, hey, anxiety, it's good to see you. right? You know, like, thanks for stopping by, or like, oh yeah, look, there's my brain doing those silly obsessions.
I know what
again.
you are. You're an anxiety, or you're a compulsion, or something like that,
Yes,
right?
exactly.
Externalizing, I guess you would say, right?
It's exactly what it is. So
Got
like
it.
naming it. So like, you know, I got into OCD treatment at 23. I just had symptoms starting at 7. You know, one of the first things we did was kind of name my OCD, honestly, anxiety monster. We named it Bitumen, because a lot of my worries are around, am I a good person or not? And these kind of things like that. So Bitumen to me sounds just like an uptight, staunch, mean person. So when it stops by, even like right now, as we're doing this, you know, my mind's like, you're not doing a good job explaining this. You're a fraud. You're this, all that kind of stuff. And I have a choice in how I respond to that. I can get up and leave. I could, you know, get all in my head and battle it, or I can kind of be like, what's up, Bitumen? Like, of course you're here. I care about this stuff, so of course you're going to show up because I want to do a good job, right?
There you go.
And learning how to respond more effectively ultimately kind of like tames the beast, if you will. Treatment's all about learning how to kind of like coexist with that difficulty versus I need to push it away, get
Change
rid
your
of.
response to
Exactly.
it. But I imagine as you're talking, I'm thinking of it's hard to get kids to do that. And I imagine, because now facing anxiety is like facing the monster.
Totally.
Right? And their initial reaction is, nope, avoid,
Absolutely
I'm
not.
out of here, my heart starts racing. So I guess I want to lump into a little bit next, along with how we approach it. You mentioned there's a type of exposure and response prevention. I imagine there's a little bit of this other anxiety therapy that overlaps with anxiety called cognitive behavioral therapy. There's a bit of that involved. But I want to kind of morph that into when the patient refuses to be a part of it, which I'm sure happens a lot, right? Then the family role becomes really important, right?
Which even, by the way, if the patient is willing to participate, the family role is extremely important.
Thank you. I shouldn't separate those.
No,
I appreciate that.
Like, you need both.
There you go.
Or the family role is always going to be involved.
That's a good way to bring home my point better than I did. So, so let's kind of talk about the family role a little bit, because one of the things that struck me as I learned more about OCD in these last few years is when I look back to my own experience with my daughter. She was reassurance seeking, and we were all too ready to give it to her. She would try to avoid things, and sometimes we would facilitate that, right? And sometimes I realized all of the things that we did to help her, we were doing it over and over, and we were actually participating in her rituals.
Literally,
Which makes me go, what? So that's the opposite. So let's talk about family roles, family accommodations.
Sure. So let me just literally set the stage here. We are biologically programmed to accommodate the ones we love and care about.
Absolutely.
Right? You see your kiddos struggling and crying, you go to soothe them, you go to nurture them. And accommodations, I just want to really preface, it's not a bad word in the world of OCD and anxiety. It all depends on like the why behind the accommodation, like what's going on. So for example, technically me driving my preschooler to school is an accommodation. But he's 3 and he can't actually drive. He's not capable of doing that, right? But say my 16-year-old, when he turns 16 and gets his license, you know, if then he's all having these worries, these intrusive thoughts of what if I drive off the road and all that? Well, me accommodating that and driving him instead is now an unhelpful accommodation. It's not giving him the opportunities to learn that he can do it himself.
Gotcha.
And every time we jump in and accommodate for those reasons to remove the distress, to remove the anxiety, a couple things happen. The intention is always pure, right? I think that for parents,
nobody wants to hurt their child.
Nobody
right?
wants.
Everybody wants to help.
That is like, you're not doing anything wrong. You're doing what your brain is wired to do.
Good, absolutely.
Right?
It's our instinct.
It's literally our survival instinct and what's kept us around for so long. So the problem is, though, every time you do that accommodation for someone who's dealing with OCD or anxiety, you are, 1, robbing them of the opportunity to learn that they can handle it. And 2, every single time that we do these accommodations, it's kind of implicitly sending the message that I don't think you're strong enough to handle this on your own. I need to jump in and save you. And something that's not talked about enough with OCD and anxiety disorders is being stuck in that cycle of doing compulsions and having accommodations happen all the time. It kills your confidence. It basically, it makes you believe that you are incapable and can't handle hard things. Because anytime something comes up that you don't like, it's like, oh, and then mom and dad come in and pull you out, right? And it works temporarily, but basically it feeds that beast. It gets bigger and bigger and bigger. So treatment, you know, what we work with heavily with parents and not even just parents, teachers, right? Because kids are around teachers all the time.
School, yes.
Pediatricians.
Oh,
right?
Yes.
Well, because, you know, you have kiddos who have potentially illness anxiety disorders.
Oh,
yeah. You know, do I have cancer? No, I told you for the 17th time you don't have cancer, Billy, right? and like working on that kind of stuff.
Yep.
Not to call you out.
No, it was appropriate. Yep.
We are working on helping them help the child recognize when OCD or anxiety is trying to come in and take over, right? So it's, instead of being like, if a kid comes to you and is like, I just had this thought that I'm going to stab someone. Do you think I'm going to stab someone? Instead of being like, of course not, honey, you're a great kid. Being like, well, it sounds like your OCD is kind of acting up again, huh? What are you feeling right now? What are you noticing it making you want to do? Right? Is it making you want to go and hide the knives, or is it making you want to go run away? Okay, well, we can notice that, right? But what do we want to do instead? What's something that we can go do right now to help get through this, right? And it's about, providing parents with ways to be more supportive of their kids. So instead of removing the anxiety, helping them get through the anxiety,
Gotcha.
right? And there's something called supportive statements, which are wonderful. It's from SPACE, Supportive Parenting for Anxious Childhood Emotions, which is a parent-only design treatment. And, it's about two things. One, you're validating, okay? You are validating the anxiety they're feeling, those emotions, those thoughts, they're real. It's coming up. Like, that's what they're experiencing. But instead of just stopping at validating and being like, okay, let me remove this thing from you, it's, and I know that you can handle it. We can get through this together, right? You can handle these feelings. So instilling confidence that they can get through them. It's very different than a kid coming to you and being like, Mom, are you sure you're going to pick me up from school today? Like, are you sure? Instead of being like, yes, honey, I always pick you up. You know that, because the reality is something could happen, right?
And certainty is
not there, right? Is it likely? Absolutely, Mom will most likely be there. But with a kiddo, parenting a kiddo with OCD and anxiety comes with slight differences. Instead of reassuring them that Mommy's going to be there, it's, honey, it sounds like anxiety is getting loud right now. What can you do to allow this to be here? And let's go play with your friends, right? Like, you can handle this feeling. Right.
So as you're talking, I'm thinking of how I could have handled it better when my daughter was struggling with this. So instead of repeating the same reassurance, that constant reassurance seeking, looking for the certainty that is never attainable, a quick reassurance followed by basically acknowledging the distress of what they're going through. That, hey, I realize, that vitamin is really, really bugging you right now, right? Or your worry bug. Or, I teach kids to call it a worry bug, a worry monster. I like the vitamin name. And then you basically help them think it through and respond in a different way.
Yeah,
that's really what it is.
Really helping them slow down the process of what's occurring, because ultimately what's happening in our brain, right? We have this trigger that pops in, and because we've done compulsions or responded in a certain way, we basically form this response, like automatic lightning response to when that trigger comes up, you do a compulsion. So what we want to do is help slow that process down. When that trigger comes up, create that space between, instead of just doing that compulsion, being able to be like, okay, this is here. Well, we could do that compulsion, but also here's a plethora of other things we can respond with, helping them kind of increase their flexibility in how they respond to things that are uncomfortable for them.
Like an example, I'm in a doctor's office. I see this a lot. Kids who have a fear of germs. They don't want to touch the table. They don't want to touch the door. And so that's one of their rituals to deal with that obsession over germs and illness. So you would basically coach them and give a quick example of what you might say to that person.
So like if he's in here and we're like doing some ERP work, the doorknob over there or whatnot, I might be like, hey, Billy, can we go into that door? And he might say, oh no, my mind's telling me it's contaminated, it's dirty, I don't want to touch it. So we talk about, all right, so your brain's telling you to avoid it. Well, what are some other things we could potentially do? Are you willing to break the rule a little bit? Are you willing to, maybe touch it? Are you willing to go near it, stand near it, kind of breathe near it, be near it? Or even like sometimes we kind of scaffold. Right. So sometimes it's like, all right, well, if you're not willing to touch it, maybe are you willing to touch it with a tissue?
Okay.
And then, or even if not even that, like a tissue with another tissue, and kind of working towards getting them to really, ideally, we want them to go grab that, door handle. We want them to, rub them, contaminate themselves, because really that's how we learn through these. We call it like, your brain's expecting these terrible things to happen. You do the exposure, and then the terrible things don't usually happen. So we kind of violate those expectations. Your brain's like, oh, hey, that bad thing didn't happen. And you kind of repeatedly do that, and their brain starts to kind of form new neural pathways. Does that make sense?
Yeah, it makes total sense. Yeah. That's a really good example.
So really helping empower the kiddo who has OCD, and also the parents too. And I talk about like this work, when we're removing those accommodations and providing more support, it's parents' exposures too. Because they're having to tolerate that distress, that, seeing their kid be uncomfortable.
Right.
Right. And I think that can help parents understand, like, oh, my kid's in distress and so am I. How can I teach them how to co-regulate, if you will? I'm not, gonna go and freak out and whatnot. I'm gonna sit here and be with them and show them support. That makes sense?
It totally does.
Yeah.
And so it seems to me that another way the families may be involved is that the families themselves often have changed their lifestyles and their daily to accommodate, to help their child, because let's say he doesn't want to drive by the doctor's office, so they go a different route, right?
Totally.
So it helps them with avoidance, and they might constantly, like I did, reassure my daughter over and over and over again. So trying to recognize that for what it is. And I also want to make the point that for anyone who might be listening, who might want to launch into this right away, parents have to be careful to suddenly withdraw all accommodations, because you might hear this and go, okay, I watched this video and we're going to stop accommodating, because that's going to make what happen?
Well, I mean, it's just,
you got to do it gradually.
It is not a good way of doing it. We call that kind of like flooding. And it doesn't typically go well.
Yeah. They become angry, aggressive, scared beyond belief, more avoidant.
Yeah,
right?
It kind of makes it worse, really. It can reinforce the fears even more. And we don't want that, obviously.
It's like pulling away their comfort blanket without giving them the tools to deal with that.
Exactly,
right?
Exactly. And I think this process is meant to be gradual. It's meant to be something that is very in line with the kiddos and the parents' values and like what's important. Because really what ends up happening with anxiety disorders and OCD and things like that is, instead of doing the things that are important, you start avoiding all those things, right? So our job is to help give them their life back, and even more than that, like figure out even more about themselves, right? And instead of having anxiety and OCD be the dictator, or inherently in having their mind be the dictator of their life and jerking them around, you can almost look at your mind as like an advisor. Like your mind's constantly throwing stuff at you.
Giving you ideas that you don't necessarily have to follow.
Absolutely. And being able to understand that, oh, like, thanks, brain. Like, I appreciate that information, that's dirty, but like, you know what? I'm still going to go in there because it's important to me. Right? And you know what? We'll deal with whatever comes our way. I appreciate you looking out for me. Because again, at the end of the day, these, OCD and anxiety disorders, it's not like inherently trying to be mean. Your brain almost just becomes like an overprotective parent who's always just like, watch out for that, watch out for that, watch out for that, watch out for that. And it just creates a very anxious kiddo. So do not just start removing the accommodations. You want to do this in a gradual process.
And with the help of someone like Andrew, who can guide you through it, is my point. Because because you do need to learn the tips and the tools that patient needs to learn, and you need to learn more about this.
Absolutely.
What's happening with their obsessions and the compulsions. What's the best logical and maybe I'll say safer, gentler approach to coach them through it.
Totally.
So we need to learn as parents how to help our kids, and they need to learn how to help themselves. Absolutely. It's part of that. It's a family effort.
And I think on that note, I appreciate you bringing up like with the help of a guided professional, because yes, I'm talking in kind of a lot of generals right now, broad sense of things, but like each person's OCD, each person's anxiety symptoms manifest specifically to them. So what works for, Billy may not work for Tom and all that kind of stuff. So being able to have someone like really look at what's going on behind the scenes in that kiddo's brain that's causing them to engage in whatever their actions are, that's going to completely, it can greatly change how we approach it, right? So I appreciate you bringing that up.
Absolutely.
I'm trying to think, but yeah.
Let's talk briefly, this is not the focus, medication, but I want to just talk briefly about the role of medication in this as one of the tools in our toolbox, especially to help those who are maybe in the medium to severe range, right? The milder ones generally just need help and therapy, or even a lot of the medium ones. And it is a family discussion with your healthcare provider. Like I have this conversation with families all the time about how bad do I think it is? Do I think medication is an option? It's, I think, good that most parents don't want to give their child a medicine. It's kind of, I struggled with it for a few years before my wife and I decided that our youngest daughter needed help, and it did make a difference. So
absolutely.
And I'm thinking in particular, there are like, I think 3 medicines that are FDA approved down to age 6 to 8 for this. Wow. So there are studies. I mean, for example, fluoxetine, Prozac. Not that I'm pushing medicines, but just tossing it out there. I think sertraline is on the list too. So you agree that would you agree, or what's your opinion on the role of meds with therapy?
Yeah, absolutely.
Do they do better when they have both? Or?
Sure. So, I know at least through the IOCDF, the International OCD Foundation, for pediatric OCD, typically the first line of treatment is ERP.
There you go.
Right? Therapy. That is a very broad statement, though. that might be someone who is mildly to moderately impacted by this. Now, if we're talking more severe to extreme levels of, school avoidance, not able to function, absolutely, we want to get medication involved, right? Because I think something that's not talked about enough, and this is just a frustrating thing with mental health, is people, when they say it's all in your head, well, there are neurochemical changes, and there's a genetic component to OCD a lot of times, especially when it shows up younger. A lot of times therapy can go a long way, but medication can give that extra boost, right? And I'm on Prozac. I honestly, my mom will laugh at this. I mean, I always asked her if I can go on medication for the longest time. She's like, no, you don't need it. You don't need it. No. It's my Jewish mother, my neo-Jew mom. I got to be honest, like, going on Prozac at 23, I would say the ERP was really what gave me like the meat and potatoes. But to be able to kind of turn the volume down of those sessions and the stickiness, I think the medications went a long way in that. I am fully a believer of utilizing all the tools that we have at our disposal, the first line treatments. And hey, if the first line treatments aren't working, let's see what else is out there too. OCD and anxiety are tricky things to treat at times, and require flexible interventions. So,
okay.
I'm a full believer in medication. Yeah.
And again, not pushing it, but what I've seen through the years for anxiety and OCD is that it really just turns the dial, the volume down on all the negative thoughts, makes it a bit more manageable, helps therapy work better. Although they're not perfect,
I would not recommend going on medication though without doing ERP or some sort of cognitive behavioral therapy or acceptance and commitment therapy
100%
treatment. Because that, UCLA, actually going back to UCLA, I think in the 90s did some study where they compared a group of people with OCD. They did ERP, one group, and then a group that did SSRIs in another. And
which are the medicines we're talking about? Like Prozac.
Yeah. Thank you. Sure. At the end of treatment, they both had like similar results. They both got better, but like the year follow-up after the people stopped their medication, most of them kind of resorted back.
They didn't have the tools they need to manage it.
And the ERP group, most of them maintained their gains.
Interesting.
So, that's why it's like, yes, there's a biological component to OCD, but there's such a huge behavioral component to it. How we respond to these thoughts. We like to think about ourselves as humans as really smart and everything, but also we're kind of just animals. So like when we respond over and over again the same way, our brain learns. So it's just really about training our brain differently. And the ERP and this type of therapy and therapy in general is about that.
So would you say that if I'm a parent and my child is entering therapy, the outlook, we call it the prognosis, the outlook for doing better is, it's not a cure, it's a management thing, right? Most of them really it's about getting them, like you said it earlier, to function normally, right? You don't get rid of the thoughts, you still have them, my daughter still has them.
Well, and on that note, intrusive thoughts are normal.
Yes.
They are not an OCD specific thing. They are a human experience.
Absolutely.
And the difference between somebody without OCD and with OCD is the person will have a certain intrusive thought and then be like, why did I have that thought? What does that mean about me? Then immediately our brain is just like, that's dangerous, right? Whereas a normal way of, or a typical way of experiencing intrusive thoughts is like, that was kind of weird.
Yeah, why did I have that thought?
Yeah, and then just kind of move on.
So I guess in the last couple minutes, I want to wrap it up with really just kind of like summarizing maybe practical tips.
Yeah.
Like we've got like 2 or 3 minutes to kind of wrap it up for parents to say. So I guess my first thought is I'll kind of summarize that really a lot of these symptoms can be common and normal to a point, but when they're to a point where they seem excessive or irrational or leading a child to be stuck or really just interfering with their ability to go on normally about their day, which we call functioning. That's the key distinguishing point, right?
Like we want to be able to, when we start seeing that, the earlier you can get them in, the better, right? Because again, our brains, if we start doing something over and over again, more and more and more and more, that conditioning just gets hammered in more and more.
There you go.
So the early intervention component is really important. Going off like the prognosis, it's honestly, this treatment is really good. It's challenging to go do exposure type stuff, but you can definitely get to a place where you would be considered like subclinical, if you will. And it's normal for these things to ebb and flow just depending on life, stressors, all that kind of stuff. But, ultimately our job is to give the kiddo and the parents the tools to recognize when their OCD monster, their anxiety monster is trying to chime in and kind of shut that down before it becomes what it was, bigger. Exactly. But you were saying practical kind of like tips and tricks. I mean, I think one, just kind of talking about and normalizing thoughts, normalizing that, brains, we're humans, we have wacky and weird thoughts
and we worry.
Right.
And
that's a normal human brain, normalizing it. And at the same time, giving them words to describe what they're experiencing. Because the more we can actually put names to what the process is, we learn that it is okay, right? Versus this big, scary, ominous thing, right? And then the externalizing, the really naming the anxiety, giving it a name can be so empowering for kids too. And, kind of having fun with it too, kind of treating it almost like a video game of okay, how are we going to level up and beat, say we name it Fred, and let's go do these challenges to really let Fred shrink and we can grow. And that's kind of how a lot of times.
I love that example because that's a great way of how you morph the skills and the draw of something they love, especially guys and with video games, and apply that to real life.
Totally.
How do you solve problems?
Yes.
Like you would grow. I love that.
Yeah.
What a great example.
So just, using that language and also just doing I always start with exposures that, the kids avoiding something that's important to them. Well, that's a great place to start, trying to get them back to what's important to them, giving them that motivation.
And so recognizing early on, as early as possible in the life of our child or teen, that this might be, well, even if it is general anxiety, getting help with that. But even the fact is OCD can be subtle when it's mental rather than observable behaviors, like too much hand washing, too much checking. Teachers see a lot of this where kids can't get their work done because they just repeatedly
erase, rewrite.
Exactly.
Right?
They need perfection and they're seeking that perfection. So there's a lot of these subtle signs. So if you have these concerns, bring it up to your healthcare provider. It's really important that we try to identify this early. There are things that can be done.
Oh, yeah.
For example, seeing people like you, someone like you. Sorry, I keep talking over you.
It's all good.
But I feel like I'm cutting out. Anything else you wanted to add? Any other tips for parents?
I mean, it's hard. I will say, watching something like this is an amazing first step in learning more about it. I think there's a lot of different layers to OCD and anxiety, and doing more research on it from reputable sources. I think going to the International OCD Foundation. There's a wonderful, wonderful movie called Unstuck, an OCD kids documentary. It's from kids' perspective of their OCD going through treatment. It's 20 minutes long. It is so good, so normalizing.
Where would people find that?
If you just literally
YouTube,
Google
maybe?
Unstuck, an OCD kids movie, it's $3 to rent. And I think all the proceeds go to the International OCD Foundation.
Cool.
So if you're, iocdf.org would be the first place I'd go to, start reading there, and then from there you can find local providers on their website too, put in your zip code, and then making sure you're not just going to a, talk therapist for this stuff, because a lot of times it can exacerbate the symptoms and kind of fall into that accommodation thing. So that can be a whole other topic.
This is why it's important knowing that it is OCD as a part of anxiety. There's a special approach to that you might not get if someone's just doing general anxiety behavioral therapy. Sometimes, right?
Yeah,
maybe not always.
Yeah.
So the way people find therapists like you, other than referrals, from people like me or from friends, is going to an organization like the International OCD Foundation, looking up who is specially trained and interested in OCD.
Yes, exactly.
Right?
Yeah.
Okay, gotcha.
So on there, it's a lot of really good resources.
Okay. All right.
Yeah, it's OCD sucks, but I always say if you're going to have something, it's not that bad to have, because the treatment's really good.
Okay.
I mean, it sucks when you're not treated, but
it does. There should be a shirt that says that, I think, right? So maybe I want to thank you.
Yeah.
And I thought I would end on two things. One is when you were talking earlier, you were getting thoughts about being anxious about maybe, am I doing a good job? I was fighting the urge to reassure you, but now I'm going to reassure you once and then say, it's okay, bitamin, go away. Vitamin, go away. And I thought we might end on an 8 clap.
Should we do it?
Should we try it? Ready? 1, 2, 3, 4, 5, 6, 7, 8. UCLA. UCLA. Fight, fight, fight. Thank you so much, Andrew.
Absolutely.